Hi, I'm Krista Bingham, and my critical appraisal of the evidence is on pressure ulcer prevention. My original PICO question was, in elderly and patient populations, does the use of pressure ulcer risk assessment tools, including Braden scores, frequent skin assessments, and wound prevention techniques compared to standard care, improve the prevalence of pressure ulcers within 3 months of implementation? The population, of course, is elderly patients, intervention, pressure ulcer risk assessment tools, frequent skin assessments, and advanced wound prevention techniques. Comparison, just standard care. Outcome, pressure ulcer prevalence. Time, within 3 months of implementation of risk assessment bundle and interventions. The relevance of this question is 2.5 million Americans develop pressure ulcers and 60,000 will die as a result each year. Pressure ulcer treatment costs an average of upwards of $43,000 per Medicare. 26% of hospitalized patients and 43% of nursing home residents will develop a pressure ulcer. An estimated 95% of pressure ulcers are preventable. My literature review, I searched the 3 databases and with the same keywords, pressure ulcer prevention, interventions, limits. I looked at articles published in the last 7 years that were written in English, peer-reviewed, and full text. I found an array from 11 articles up to over 2,000 articles in each one. The best articles I found, the first one being effectiveness of pressure ulcer prevention strategies for adult patients in intensive care units, a systemic review. The second one, preventing pressure ulcers, a systemic review. The third, importance of nutrition for elderly persons with a pressure ulcer or a vulnerability for pressure ulcers, a systemic literature review. So all were systemic literature reviews, each one with about the same method, involving the first one, 25 peer-reviewed studies and randomized controlled trials and quasi-experimental and comparative studies using 6 databases were analyzed. The second used the most, 59 studies using 4 databases were analyzed, and in the third, 16 peer-reviewed articles from 2 databases were analyzed, each with different results. In the first study, effectiveness of pressure ulcer prevention strategies for adult patients in intensive care units, the title adequately described the content of the research paper, but remained vague in what strategies are evaluated. The purpose was explicitly stated, and it showed the best evidence regarding the effectiveness of strategies to reduce the incidence of pressure ulcer development in the ICU. The literature review was, as I previously discussed, 25 peer review studies were analyzed. Variables, the X variable was pressure ulcer prevention strategies, and Y variable being pressure ulcer development. Research design, it used a systemic review and meta-analysis were used to synthesize relevant data. Human protection was not analyzed. Data collection and tools, 6 databases were used using the relevant keywords. Data analysis, quantitative data was pulled into groups for a statistical meta-analysis when heterogeneity between studies allowed. Results, the statistics indicated the use of foam dressings, support surfaces, nutritional supplements, 2-hour repositioning, early mobility, and nursing education on decube prevention reduces the development of ICU-acquired pressure ulcers, although research was limited, so more must be obtained, which leads us to limitations. The research included studies with small sample sizes, potential bias, lack of randomization, and heterogeneity issues. Nursing implications, education on the use of foam dressings and support surfaces on bony prominences, the use of turning schedules, and high protein supplementation for at-risk patients should be implemented by nurses. The second study, entitled Preventing Pressure Ulcers, a Systemic Review, The title, again, was vague, but the purpose is clearly stated, and they do systemically review the best evidence regarding the effectiveness of strategies to reduce pressure ulcer development. Literature review, again, as I discussed, 59 RCTs using 4 databases were found to be relevant. Variables, X variable, preventing pressure ulcers, and Y being pressure ulcer development. Research design, it was a systemic review and meta-analysis. Human protection was, again, not addressed. Data collection, the study quality was assessed using a clear NPT checklist for evaluating non-pharmacological trials. It is not stated how many reviewers performed the quality assessments, though. Data analysis studies were combined using a narrative synthesis into congruent categories. The study classified the randomized controlled trials as generally poor, with commonly conflicting results. The results, though, were, given the quality of studies included were poor, the least ambiguously effective strategies included the use of support surface or overlays and nutritional supplements. Limitations, there's insufficient evidence to recommend specific turning regimens. The benefit of specific topical agents over simple moisturizers for patients with impaired skin health is unclear, and other issues related to data unavailability. This simply is just not being studied enough. Nursing implications, using support surfaces, optimizing nutritional status, and moisturizing sacral skin are appropriate strategies to prevent pressure ulcers. Third study, entitled Importance of Nutrition for Elderly Persons with a Pressure Ulcer or a Vulnerability for Pressure Ulcers, a Systemic Literature Review, does adequately describe the aim of the study and intervention. The purpose, of course, is to assess the importance of nutrition in reducing the risk of pressure ulcers and other related nursing interventions. It's a little more specific. Literature review, they use 16 peer review articles from 2 databases. Variables, X variable being nutrition and Y variable being vulnerability to pressure ulcers in the elderly. Research design was a systemic review. Human protection, again, not addressed. Data collection and tools, it is not stated how many reviewers performed the quality assessments of relevant data, although a 3-point scale was used to reflect the quality of the studies that were included. Data analysis, the data concluded that there is a correlation between pressure ulcer development and poor nutritional status in the elderly, as well as low weight and albumin levels. Results, nutritional supplements with additional protein decrease patients' susceptibility to pressure ulcers, as well as maintaining a healthy BMI. Limitations included studies with small sample sizes and potential bias. Nursing implications, nurses must evaluate patients' nutritional and hydration status adequately to assess pressure ulcer risk and implement prevention interventions in a timely manner. In conclusion, the data compiled by these studies reflect the imperative need for nurses to adequately address patients at risk for pressure ulcers, including assessing their nutritional and hydration status and implementing appropriate interventions, including pressure distributing mattresses, overlays, protective dressings, barriers, creams, turning schedules, and appropriate nutritional consults and supplementations. The references are as follows. Thank you for listening.